If you have Medicare, now is a really important time to pay attention. A big deadline is coming up. Here to talk about that is Cathy Mcveigh, the Director of Medicare with Optima Health. Thanks so much for sharing information and shedding a light on this topic.
Thank you for having me. I really appreciate you having me on the show.
So the deadline is December 7th.
That's correct. The annual enrollment period started on October 15th. Okay. And it will end on December 7th. Very important deadline.
Okay, why is it so important that people who are on Medicare take their paperwork out and kind of review what the options are?
I think it's important because there are a lot of people that have Medicare Part A, which is your hospitalization, and Medicare Part B, which is your outpatient doctor's visits and labs and things like that. And they may not have anything else to go with that. So they're finding themselves paying a lot of out-of-pocket expenses, which could be upwards of 20% of what your doctors and your hospitals aren't paying. So this is the time, if you haven't selected a plan to go with your Medicare plan, such as a supplement or a Medicare Advantage plan, this is the time frame you're allowed to do that.
And it's the only time of year that you can.
It is the only time of year that you can do this. And as well as selecting a prescription drug plan, if you have a supplement plan, you must also shop for a prescription drug plan. So that's real important to know. And if I could just say, on a Medicare Advantage plan, you have all of that all in one. Okay. So you kind of have everything together. So if you're selecting a Medicare Advantage plan, you have your Part A, your Part B, and your Part D, which is your drug plan. And Medicare Advantage plans are called Part C. Okay. So it kind of wraps it around.
And it's a lot really to take in, honestly. It is. But what would you suggest someone to do as they're reviewing their plans and trying to figure out whether they need to add something or move something?
I would say look at your current plan and look at the benefits, and then request information from all the carriers that are out there and ask them to send the booklets to you or information so that you can start making that educated decision on what's in the plan that I need, what didn't I have this year, what kind of health experiences did I have this past year that I may need something different next year. Right. And I think more importantly would be the physicians. Look at your network. Make sure your doctors are in the network of the plan that you're looking to.
Because when we're talking about unexpected expenses, that could be something that could add to how much you have to pay if it becomes that doctor has moved to another network.
That is correct. You would be responsible for the entire charge of that visit.
Okay. And as far as prescriptions, that's something to think about as well.
Prescriptions are very important, so you need to make sure that you check your plans each year and make sure that your prescriptions that your doctor may have not given you last year as a new prescription this year, make sure that prescription's on that plan with that carrier.
There's a lot to go over here. Do you have a place where people might be able to ask questions?
We do. You can contact our Optima Health Plan Advisors, and that number is 855-556-8897.
Wonderful. People can get their questions answered there. Cathy Mcveigh with Optima Health, thank you so much.
Thank you.